Hi, this is Dr. Ryan Pribble from Bloomington Sports and Wellness, and today we're going to go over what it's like when we treat the bottom of the foot for plantar foot pain. So what we're doing here is I'm looking for where there's grit in the tissue. The grit is the sign of the adhesion that we want to break down. So what I'm doing is I'm making some scanning passes till I find the area with the worst amount of adhesion. So I'm running through all the different areas of the foot, and then I'm going to actually change the depth. So now I'm going to go deeper into the foot and get to the deeper layers of muscle. And as she'll tell you, this deeper area is where we're picking up on the most grit, where the most adhesion is. Adhesion is responsible for this foot pain, and as we fix this and reduce it, the pain will go away. So that's about all the bottom of the foot will take today. So if you have unresolved foot pain and your doctor's not assessing and treating the bottom of the foot, give us a call, we'll take a look and see if it's something that we can get fixed up for you. Have a great day.